with the Integrative Wellness Center of San Diego. Welcome to the live video today on type 2 diabetes. And again, I'm the owner of Integrative Wellness Center of San Diego, and also the author of How to Reverse Your Diabetes. As you can see our book right there. So today what I want to talk about is I want to talk about the top 5 reasons why you still have diabetes. This is super important because I talk to a lot of patients on a weekly basis, and they have been doing so many things, thinking they're doing the right things, and actually they're getting worse in many situations. So before we jump into the video, I just want to go over a specific patient, a testimonial, if you will, that we had in our office recently. This was a type 2 diabetic who had been dealing with diabetes for many, many years, taking multiple different medications, super skeptical that they had a potential option to reverse their diabetes. And within 1 month, he's already reduced his blood sugars by over 30 to 40 points on a regular basis, already reducing one of his medications and seeing the many benefits of reversing your diabetes that so many of our patients have experienced as well. And this is the type of thing that we see very regularly in our office. We rarely ever see a patient fail, which is phenomenal. It's a lot of fun doing this type of work. So hopefully this video today will be valuable for you. The information will be valuable. And if it is, all I ask is that you comment, that you like the video, that it was worth your time. If you have any questions about the video itself, please post them in the comments and I'll respond to them as well. And of course, we would love for you to like it and share it to other people who may benefit from this video as well. So let's jump into today's topic today, the top 5 reasons why you still have diabetes. So number 1, the first one is you're focused on the diet. Now this is a common thing that we see with most of our patients, that they are so focused on the diet itself and really missing the big picture. Now if you think about it, there's tons of different books out there, there's different options online. You can buy recipes for diabetic friendly or diabetes friendly, diabetic recipe books, all these things that are out there you can do on a regular basis. The interesting thing is that these diets don't work. And the reason why they don't work is because the focus of the diet is really on managing your blood sugars and really not addressing anything else that could be going on under the surface of what's going on with your blood sugars. And we'll get to that in a minute as I go a little further along into the video. So if your focus only is to reduce blood sugars, then absolutely, these diets will be very beneficial. They're low sugar, low carb, those types of things, but they can also cause other harm by the type of diets they're recommending here. But if your focus is only to reduce the blood sugars, then you're missing the big picture, which I'm going to tie it all in together at the end of this video here. So the first reason is because you're only focusing on the diet and you're not looking at all the other things. Even when you get diagnosed for diabetes, your doctor is typically going to recommend you change your diet, whatever that might mean. Or if you go to the diabetic classes through your healthcare provider or some of the institutions that are around the country or in San Diego here alone, then they're going to tell you very similar type things. This is what you should be eating, this much carbs, this much protein, this much veggies, whatever it might be. But every single other person is going to be getting the same recommendation as well. Now, if these things actually worked, we would see less diabetes, but we're seeing more and more. We would see more people getting off their medications and getting back into their health or quality of health, but we see less of that happening. So diet is the first thing that I want to discuss and focus on. I can't tell you how many people that I talk to on a regular basis that they're thinking, if I just have a better diet, if I just change my diet, I'm going to take care of my diabetes, I'm going to be able to reverse it. I will tell you that will not happen. You will definitely be able to lower your blood sugars, but it will not reverse your diabetes. We'll talk about that reason in a second. The number 2 reason is exercise. Now, of course, we all know that exercise is beneficial. It's great for the cardiovascular system. It's great for your muscles, for your joints. And it's also going to help you lower blood sugars. Absolutely, that'll happen. But again, it's focusing on lowering the blood sugars and not addressing the overall mechanism with diabetes. As we go a little further along, we'll talk about that. So the focus, again, is when you get diagnosed, the recommendation is you need to start exercising. You need to start exercising and exercising. And many individuals that we see in our practice that we're dealing with diabetes, we don't let them exercise because the exercise could be causing more harm than good. And hopefully that makes sense to you. If it doesn't, maybe we need to talk. All right. So exercise is another thing that is commonly focused on, and thinking that if I just exercise enough, I'm going to be able to take care of my diabetes and get back on a normal track and get healthy again. Unfortunately, exercise is more than likely not going to be the cure for your diabetes or the fix for your diabetes, as we've seen with many individuals in our practice. The third one is going to be losing weight. Most people believe, and they're being told this, that if they just lose weight, and your doctor may tell you, if you just lost 30 pounds, 40 pounds, you'd be able to get off your medications, you wouldn't be diabetic anymore. I have spoken to many, many patients. They've lost 50 pounds, 60 pounds, 100 pounds plus. I had one patient who lost over 150 pounds, and she was still full-blown diabetic, out-of-control diabetes. You know, we have this belief system that your weight is the cause of your diabetes. Well, if that were actually true, then why do we have skinny diabetics? Why do we have people who have diabetes that are completely thin? And we also have people who are obese and they still don't have diabetes. So again, your weight is not the problem in many cases. In most cases with diabetes, the weight is a symptom of the disease, meaning your weight continues to get more and more buildup because of the excessive sugar or potentially some of the medications you're taking that is causing you to gain weight, like insulin. So by losing weight, yes, it'll help you lower your sugars, but no, it will not help you take care of your diabetic condition. So these three right here, diet, exercise, and losing weight, are the three most common things you're being told when you have diabetes. You go to your doctor, they say, you ask your doctor, what am I going to do to help me reverse my diabetes, to get rid of my diabetes, to get off this medication? They tell you, we got to change your diet, you got to lose weight, you got to exercise. Right? These are the common things that are being told for most diabetics, and I can tell you from my perspective, in working with diabetics now for many, many years, nearly 17 years of practice at this point, we don't see this as the underlying mechanisms for diabetes, right? These are the best things that you can do to help you manage or lower your blood sugars, but these things will not fix your diabetes in most cases. In most cases, there's much more going on. Most of the patients that I've seen in my practice have already done these things, and they're still out of control diabetes, and they have nowhere else to go and don't